Springtime in Arkansas typically means you're bound to get allergies. And why do we get so many allergies during the springtime? Well, today we are at AOC where Dr. Meredith Dilley is going to be answering all of those questions. You are an allergist here.
Yes.
Thank you so much for
you.
joining me. Why does it seem like we get the worst symptoms of allergies during the springtime?
So springtime is when trees pollinate, and in the springtime the days are getting not only longer but warmer, so it allows trees to spread more of their pollen, and that just happens to be what the majority of people react to with regard to allergies.
I just got over some of my allergies and I was congested. I did have a runny nose as well, but what are some of those common symptoms that people usually get?
Yeah, so those that you mentioned, itchy nose, eyes, sneezing, watery eyes, sometimes even swelling in the eyes and nose can be common.
I feel so bad. My husband gets the worst allergies and his eyes get bloodshot and runny like you said. But let's talk about the differences between a cold and allergies. I think that people still get confused of what they're having.
For sure. Yes, so cold would usually be limited in the time frame, and so 7 to 10 days. Sometimes you can have a fever with a cold. With allergies, you may expect a longer duration of symptoms, so weeks to months, depending on how significant that patient's or person's allergies are. And then you usually do not see a fever with allergies as often.
How do we know when we can just get over-the-counter medication versus coming to see you in clinic?
So a lot of the over-the-counter medications are helpful and effective, and when those either are stop working or are never working, if a patient has prolonged cough, asthma that is difficult to control, or repeated sinus infections, that is a really good time to see an allergy specialist.
And how are you helping as an allergist with those symptoms?
So we target our treatment based on the testing that we do. So we do what's called a prick test. So we prick the skin with a little device, and at the tip of the device is a liquid purified allergen. And so we test for relevant allergies that in Arkansas, and then we tailor the treatment based on the testing.
So that typically is done on someone's back,
yeah,
correct?
It's done on the back usually. You can do it on the forearms, but we find the back to be the biggest surface area. And then once we have the results, we determine what treatment would be helpful. For some patients, that's more prescription-based medications, but because we can identify each specific allergen, we can tell patients what to avoid or target a allergen immunotherapy, which would be like an allergy shot. And that can be extremely helpful because we are treating the problem, not just managing the symptoms.
If somebody does want to go the allergy shot route, how long does that typically take?
To complete the therapy is usually 5 to 6 years.
Oh, wow.
Yeah, so it's a long-term treatment, but at the end of it, your allergies are essentially better.
Sure. Dr. Dilley, if someone doesn't live local in Little Rock, can they still access those services?
Absolutely. So we usually will have patients come here for their initial testing, and if their recommended therapy involves administering allergy shots, we can coordinate with their local clinic in their hometown to provide the same services.
What other services do you provide here?
Yeah, so at Arkansas Otolaryngology, we treat the gamut of allergic conditions, so eczema, food allergies, asthma, chronic hives are all big ones. We also treat immune disorders.
Do you treat people of all ages?
We do. So we see anywhere from infants all the way up through adults.
If people want more information, how can they get that?
Sure, they can go to our website or call us, and the number will be provided.
Perfect. Dr. Dilley, thank you so much for your time.
Thank you.
I appreciate it. We'll have more Good Morning Arkansas after this.